Targeted therapies are therapies that are directed to particular molecular mechanisms or byproducts within the cancer cell in an attempt to really obstruct the cancer cell's growth. If you use a variety of different agents at the beginning of therapy to really get into the site on the tumor cell, at a site, a molecule called the androgen receptors, like a key going into a lock, testosterone has no place to go. I'm just so pleased to be one of several speakers at this inaugural Prostate Cancer Advocacy Summit, and it really represents a collaborative effort to really bring education to patients.
What we've been tasked to do in molecular imaging is to figure out where the PSA is, where the markers are, what's happening with the genomics.
It's really been an exciting time in imaging because the FDA really opened up a lot of exciting therapies for oncology first, starting in 2005, and about 6 agents have been approved. Right after that, a lot of imaging agents have been approved, and the one that we're really excited about right now is PSMA, because that allows us to image using prostate-specific membrane antigen.
The nice thing about technology is we can identify certain targets. PSMA is one example, but in the clinic now, in any given week, I might have a TROP2 target or a DLL3 target. There's just examples of proteins that are stuck to the surface of cancer cells, including prostate cancer, and not so much on other cells, and we can use the carrier with a drug or a piece of radiation attached to it, infuse it into the bloodstream. That treatment then goes to the cancer cells, preferentially over any other parts of the body.
And as you can see down the line, PSA undetectable, tumor's gone. So we've been working on this type of a process for about 15 years, and that has gone from phase 1 to phase 2 and now in phase 3 trials with the hope that we will have these types of drugs available to us in the near future, hopefully the next couple of years.
So the idea behind immunotherapy is to use the body's natural defense systems against cancer. The body has immune cells that are designed or evolved to kill cells that were infected with viruses. These cells also have the capability to recognize and kill cancer cells, and the idea of immunotherapy is to give drugs or to do things so that these cells recognize and kill tumor cells. There are actually 2 immunotherapies that are currently approved for prostate cancer. Patients should really think about having their tumors tested for MSI. Maybe about 3% of prostate cancer patients are eligible for these drugs, but they're out there and they're ready to go.